Okay. Everyone knows the phrase, with great power comes great responsibility. This lies in truth with pediatrics. With a great job comes great responsibility. When someone's life is on the line, the job becomes a very difficult and daunting task. However, the hours that are put into tough schooling and overwhelming work days is just a small price to pay when it comes to changing a child's life. You never know that someday the sick baby that you held in your arms and nurtured back to health will send you a thank you card every holiday. And you never know that someday the family of a longtime patient of yours might grow to be a great family friend. Every patient and every child has a story, and if I can be a part of a child's story and make an impact in that child's life in any way, shape, or form as a healthcare provider, then I will have fulfilled my goals in ISM and in life. So with that said, here's my story. Hi, my name is Nicole Cruz. My topic of study this year is pediatric nursing with a focus of becoming a pediatric nurse practitioner. I'm a Filipino by birth, but a homegrown Texan by heart. I like to draw and strum on my ukulele on my free time, and although I'm not as good as I think I am, I'm 17 and I'm a dancing queen. I have a beautiful family of 4, my parents who are also nurses, and my 2 younger little sisters, my precious 6-year-old Daphne, and my not-so-precious 12-year-old sister, Danielle. I also have 2 dogs, Jedediah and Roxanne. As far as my school life goes, I am involved in HOSA. I've been a member for 3 years, and I'm a historian for this year. And I'm also involved in student council and all their committees. I'm in NHS, which is National Art Honor Society, National Honor Society, and I also volunteer at my church, Hope Fellowship, and I also contribute to the community by volunteering at various Frisco events such as Frisco Volunteen and Miracle League. So I started off my research in ISM in a fairly broad aspect. I wanted to learn more about what the role of a nurse practitioner is and what I should expect when I enter that field. So in my first research assessment, I looked into what they do and what their day-to-day basis is, and like what kind of schooling I have to go through, and basically everything I need to know before I go in deep in college. And in my research assessment number 2, I looked into the role of neonatal nursing, just because I was always interested in that field. Like, infants are a field of interest of mine, and I've also have experience in the in the NICU, so I wanted to look more into that as well. And in my research assessment, for my third research assessment, I looked into the private practice because I wanted to see the difference between the hospital life and private practice. And in my research assessment for pediatric trauma, I wanted to look more into how trauma is different from pediatric practice. So I looked into that. And then my research assessment, my last one that I conducted, that was the one that I put in the most work for. That was the one that I looked into for my final product and my original work. So I'll get into that in the next slide. So aside from reading articles and research, we also get to get firsthand knowledge about the field of interest that we are interested in by talking to people who work in that profession. The people who work in pediatrics are probably some of the, or if not the nicest and most genuine people you'll ever meet. And so I got the honor and privilege to meet very, very delightful, inspiring people who work in that field. My first interview was with Miss Christina Stiliano. She's an ER nurse at Children's Medical Center of Plano. And she has been an ISM student herself, so she knew exactly what position I was in and like what to expect. So she also told me about advice as I go into ISM. And she also laid out a career path for me because I was a little unclear about what my life would be like in the healthcare field after college. So she gave me a good roadmap to follow and like what to expect. And she also recommended good colleges to look into for the nursing program. Let's see. My next interview was with Miss Maria Crane. She's a pediatric nurse practitioner who specializes in allergy and immunology at Children's Medical Center of Plano. She's a very sweet lady, and what the biggest takeaway that I got from that interview was that life doesn't really life isn't as expected as you will make it to be. She's worked in various places such as New York and Philadelphia, which are two completely different settings as compared to the suburban affluent community that we are in of Frisco. She advised me to take me on everything on a head-on attitude and just absorb all the opportunities I get to learn wherever I go and wherever my path takes me. So my third interview was with a familiar face. This is Dr. Versailles Capote-Pica. She is my family pediatrician, and she's been my healthcare provider ever since I was a tot. And I firsthand got to witness how devoted and passionate she is about her job. And like right off the bat, I have developed a deep respect for her as a successful woman and a doctor. She told me about the private practice and how different it is from the hospital care, and that if I'm interested in developing lifelong connections with my patients, that would be a good thing to look into, like as a long-term goal. My next interview was with Mrs. Lori Thornton. She's an orthopedic nurse practitioner at Children's Medical Center of Dallas. We basically covered the same things. We talked about her clinical experience, and we also talked about the holistic approach in pediatrics and how she's trying to implement that into the healthcare field. She told me more about the heartbreaking topics such as abuse, bullying, and negligence when it comes to taking care of kids. So we got into a more deep and emotional side conversation. My next interview was with Miss Sonia Estep. She's a pediatric nurse practitioner as well, and she also works in a private practice. She has a very good record on her paper. Like, she's been everywhere. She's had so many experience in every field, whether that be in infant care or trauma. She's been everywhere, so that was a good interview because I got her insight on like the more overall aspect of pediatric care. And then my last interview was with Coach Goff's good friend, Mr. Rob Higginbotham. This was a different interview, but it was refreshing and different just because it didn't really feel like an interview. We just had a conversation, and I liked that because it was more relaxed and easygoing, and we just had a good talk about where his life has taken him, and we also talked about my culture and rice and Filipino food, so that was really fun. And other ISM events that helped me get here was the Business Symposium. I got to interview Mrs. Dana Bird Hanks, who was a social networker, and she really helped me because she tailored our interview session specifically to me, and we kind of had an interviewception where she conducted an interview within our interview. She asked me questions about like common questions that I would most likely receive if I apply for a job, so that helped me in preparing to my future. And in our UTD field trip, I took mostly science classes that pertain to the healthcare field, so I got a good idea of how college life is like and what to expect when I get there. So in my original work and final product, I was brainstorming ideas for that when I was doing my research. And when I came across my research, they all focused on the importance of patient safety, family communication, and the efficiency in the workforce. And that's why I looked into evidence-based practice, otherwise called EBP. So what is evidence-based practice? Evidence-based practice questions common methods of doing things for the better in order to enhance the efficiency of the workplace as well as improve clinical outcomes of the patient's quality of life. In evidence-based practice, you isolate an area that has room for improvement, and then research the science and technology innovation that will provide a good and safe improvement to that solution. So I don't have the specifics figured out yet, but I hope that my mentor, as soon as I get my mentor, I'll be able to see the medical field and what kind of problems that can be made better or solved, and then base my final product in that. But the original work, what I plan to do is that I plan to produce a survey report asking clinical professionals as well as patients on their preferences on basically everything they come across in the healthcare field. And I will put that into a report, probably make a visual aid, and use that as part of my final product. With that said, I give you my quote and mantra for this year. Success is no accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you are doing or learning to do, by Pele. I take this quote to heart, not only because it was said by one of the greatest soccer players who ever walked this earth, but also because I believe it encompasses everything about my journey in ISM and in life. My aim for this year in ISM is to apply my determination, passion, and dedication to the healthcare field, as well as build long-lasting relationships with every patient or person I come across. Yeah, and that's it. Thank you.